Welcome to the Kidney Stone Center at St. Michael's. This is a provincial program affiliated with the University of Toronto. The lithotripsy suite houses one of 3 lithotripters in the province. Our program, which has been in operation since 1987, has treated more patients than any other center in the world and is renowned for its leadership role internationally. On arrival, you will be required to complete the registration process, where the clerical staff and nurses will ensure that all pre-treatment tests and x-rays have been completed. The majority of patients will have a single x-ray prior to treatment to ensure that the stone location has not changed. You will then be given an opportunity to watch this educational video. The procedure today is called shockwave lithotripsy, or SWL for short. Lithos is from the Greek word for stone, and tripsy is from tribion, to rub or break. Shock wave energy is produced by an electromagnetic shock head and focused up through your body onto the stone. The aim today is to break your stone into small enough particles, 2 millimeters or less, that can pass out through the urinary system with minimal discomfort. To help you understand your urinary system, here is a diagram. Most patients have 2 kidneys that filter urine from their body. The urine collects in cavities within the kidneys and drains through tubes called ureters into the bladder for storage. The bladder empties via the urethra, the tube leading to the outside. A kidney stone, or calculus, forms within the cavity inside the kidney. It may stay there, attached to the wall, but may pass into the ureter where it can become stuck. Stones can be treated with SWL in the kidney or ureter. Before entering the lithotripsy treatment room, you will be interviewed by a nurse, your treating urologist, and the anesthetist. Your history, test results, and x-rays will be reviewed, and some of the questions are repetitive. You will then be taken to the lithotripsy treatment room. You will be asked to remove your housecoat, but your gown will be left on to ensure your privacy. You will then be asked to get up on the lithotripsy table. This is like an x-ray table with a soft elastic membrane in the center to support you. The anesthetist will then insert an intravenous in order to give you some medication to help keep you relaxed and comfortable. ECG leads and a blood pressure cuff will be applied to monitor your heart rate and blood pressure during the procedure. You will be given supplemental oxygen to breathe while you are sedated. Your position on the table will be adjusted and a small amount of water will be poured onto the elastic membrane supporting your body. You will feel your body lying in a small amount of water. The shock head will then rotate into position. The table will move and a C-shaped X-ray arm will rotate in to target the stone. You will be notified when the treatment is about to begin, and then you will hear a clicking sound and feel a tapping sensation on your back. Try to remain quite still during the treatment, as any movement may interfere with the treatment of the stone. The power of the shocks will gradually be increased, and if you feel any discomfort, remember to raise your left hand so that more pain-relieving medication can be given by the anesthetist. The treatment takes about half an hour, after which time you will be taken to the post-anesthetic care unit where you will be monitored until the effects of the sedation have largely worn off. While in this area, your blood pressure will be taken and the treatment area will be checked. An area of redness is common and usually disappears over the next few days. You will be offered something to eat and drink when you are ready. Usually after 1 or 2 hours you will be ready to go home, but as you will still feel some effects of the sedation, it is necessary for someone to accompany you, and you should not drive a car for 24 hours. On discharge, you will receive written and verbal instructions on what to expect after your treatment. You will also be given a strainer to catch some stone fragments, a requisition form, and a pre-addressed envelope for stone analysis. If you experience any pain, you can take the prescribed pain medication. However, you should call your urologist or go to the nearest emergency room if you are having severe pain which is not relieved by the oral medication, or if you develop chills with a fever higher than 38.5 degrees Celsius, or if you develop persistent nausea or vomiting. If you are within the Toronto area, you will be given an appointment to the lithotripsy clinic approximately 2 weeks after your treatment to assess the results of lithotripsy. If you live more than 1 hour outside of the Toronto area, you will be advised to make an appointment to see your own urologist after 2 weeks. Some patients with larger stones or stones in the ureter may not be adequately fragmented by one treatment, and about 15% of our patients do require a second treatment. This may be booked immediately after treatment or when you are seen at the 2-week follow-up visit. If you are interested in stone prevention, please ask the staff about the Provincial Kidney Stone Prevention Clinic. If you have any questions, please call the Kidney Stone Centre at 416-864-3030 or toll free at 1-800-263-2885. During your time in the unit, please feel free to ask us any questions you may have about the treatment or the period following lithotripsy. The staff is here to look after you.